Welcome to this demonstration of the Welch Allyn Connex Spot Monitor. The Connex Spot Monitor, or CSM, is intended to be used by suitably qualified staff for spot checking and interval monitoring of blood pressure, pulse rate, SpO2 and temperature, and can be used with neonatal, pediatric and adult patients. The CSM can be customized and configured to work in many different ways. However, this video will provide you with a simple overview of the most commonly used functions. On the front of the device is the power switch and the touch screen. Depending on the configuration of your device, you may also have the SureTemp oral axilla thermometer, or like this model, the Braun Pro 6000 ear thermometer. On the bottom of the device is a power connector, the blood pressure hose connector, the SpO2 connector, and a USB port for a barcode scanner. To begin using the device, press the power button and wait for a few seconds. The LED above the power button glows green when the battery is fully charged or amber when charging. If the device is already on but in sleep mode, it can be reactivated by just touching the screen. The home screen will appear when the device is ready to use. The top of the screen has the following information: clinician ID and name. This information may not be required by your hospital for routine observations. Patient name and ID. Again, this information may not be required. Device location, time, connection status if you're transmitting to the EMR, battery capacity in hours and minutes, and finally, device profile. The rest of the screen contains vital sign tiles displaying NIBP, SpO2, pulse rate, and temperature. It is also possible to enter up to 20 manual parameters such as height, weight, pain, and respiration if desired. These manual parameters are essential if using the CSM to calculate early warning scores. There is also a clear button to remove readings from the screen and a save button to transmit data to the EMR if required. The CSM is generally used two ways: for spot checking and for interval monitoring. It is easy to switch between these profiles by touching the people icon on the top of the screen. Select the desired profile and then touch the Home tab to return to the main screen. The Spot Check profile is optimized for taking a single set of patient observations. Alarms are not available in this profile. To begin, attach the blood pressure cuff and SpO2 to the patient, following your hospital guidelines. You are now ready to take the patient's vital signs by simply pressing the Start button on the CSM screen. The cuff will begin to inflate. Within about 20 seconds, the patient's blood pressure, SpO2 level and pulse rate should be displayed on the screen. The patient's temperature can also be taken if either of the thermometry options are available on your device. For this demonstration, we are using the Pro 6000. Attach a probe cover to the tip of the thermometer and take the patient's temperature from the ear. Dock the thermometer back into the device and the result will appear on the screen. You now have a full set of observations. If your device is connected to your electronic medical records, you can save and send your patient observations instantly by simply pressing Save. If your device is not connected to the EMR, you will have to document the patient observations manually following your hospital guidelines. Interval Profile enables you to set automated and timed observations with alarms. To set automatic measurements, press the interval icon. From here, you can configure timed observations by using the keypad and then touch Start Intervals. Program intervals allow you to take automatic measurements at variable intervals. For example, NIBP every 15 minutes for the first hour, then every 30 minutes for the next hour or so. You can also configure the monitor to take NIBP measurement continuously by pressing the Stat icon, then Start Intervals. In Intervals Profile, the monitor will alarm when a patient's vital signs measurements fall outside of set alarm limits. There are high and low priority alarms. When an alarm is triggered, the relevant tile is highlighted and a warning tone sounds. To pause the alarm, press the alarm icon in the upper left-hand corner of the screen. To turn off the alarm, press the alarm button on the right side of the parameter tile and switch it off. To set alarm limits, touch the bell symbol next to the relevant tile and adjust accordingly. An alarm will also be activated if there is a technical fault with the device. In this scenario, please contact your medical engineering department for assistance. Patient data is managed by pressing the arrow in the patient tile at the top of the screen. Data can be entered manually using the keypad or automatically using a barcode scanner. In this area, you can also enter additional patient information such as modifiers and manual parameters. To review or delete a patient's records, touch the Review button at the bottom of the screen. To turn the CSM off or put it into sleep mode, press the Power button and select the relevant option from the on-screen menu. Thank you for watching this overview of the Connex Spot Monitor from Welch Allyn. For more information, please contact your local Welch Allyn representative or visit our website.